House Bill 10, as amended by the committee substitute, also known as the Momnibus Bill, is legislation which will address Kentucky's high rate of maternal mortality. Kentucky has the unfortunate ranking as number 2 in the nation in maternal deaths in the year following childbirth. There are several reasons for this, including our high rates of substance use and substance abuse among childbearing aged women and the lasting and often devastating effects that this has on moms, babies, and families. In fact, 53% of women who die in the year following childbirth die as a result of their substance use disorder. Other factors include Kentucky's high rate of obesity, diabetes, heart disease, and mental illness. These are all made more difficult during and after a pregnancy and can cause dangerous situations. Deaths due to any of these factors are usually preventable, and the ways to prevent these deaths are to identify and treat these diseases early in the pregnancy, if not before. This is why prenatal care is so critical. Several problems were uncovered during an interim-long bipartisan bicameral working group of legislators, and some gaps and barriers to providing needed care were identified, and the solutions are being offered here. In investigating the high maternal mortality numbers in Kentucky, we discovered that pregnancy is not considered a qualifying life event for insurance coverage. It also uncovered that there is no structured mechanism to accessing mental health care quickly, and that Kentucky families lack support during the postpartum period to keep mothers, babies, and their families healthy. To address the lack of access to prenatal care, we are ensuring access to insurance coverage for pregnant women. There are special enrollment periods to buy insurance coverage at any time of year for adopting a child or fostering a child. There are special enrollment periods for marriage and even divorce. But there is no special enrollment period for pregnancy. A special enrollment period will allow pregnant women to purchase insurance coverage for pregnancy to get the care that she and her baby need during the prenatal period for a healthy delivery and during postpartum when life gets really hard. To address the lack of access to mental health care, this implements a new psychiatric access program called Lifeline for Moms, which establishes a hotline for providers to get an immediate consultation for a mother in need of mental health services. Kentucky has already applied for and received a $750,000 grant to begin to implement this program. This simply codifies that program. This bill strengthens the Kentucky Maternal and Infant Health Collaborative by specifying the needed stakeholders to study birth and pregnancy outcomes, make recommendations to improve outcomes, provide oversight for the Lifeline for Moms program, and provide an annual report of their research and observations. This legislation expands the existing Health Access Nurturing Development Services, or the HANDS program. This home visitation program is available during pregnancy and up to 3 years following a child's birth, and will, in this new law, add providing information on the benefits of breastfeeding and referral for lactation consultation when needed, and lactation equipment will be an insurance-covered service. Additionally, education on safe sleep will be provided. Co-sleeping was identified as one of the primary reasons for accidental death of an infant. The HANDS services will also be available via telehealth if needed. And just as a refresher, the goals of the HANDS program are to facilitate safe and healthy delivery of babies, provide information about optimal child growth and human development, facilitate the safety and health of homes, and encourage greater self-sufficiency of families. In this language, doula services will also be studied and reported back to the legislature. The committee substitute simply added remote patient monitoring and also in-home addiction treatment for patients with transportation issues, or who are too ill to travel. It will also add 2 members of public health, including local health departments, to the Maternal Infant Health Collaborative, and it specifies that this provision is available to pregnant women. Mr. Speaker, I would like the clerk to report House Floor Amendment 1.
Mr. Clerk, please report.
House Floor Amendment 1 to House Bill 10.
Lady from Kent.
Mr. Speaker, this floor amendment addresses some concerns that insurers and small business owners had about providing insurance through small group plans and short-term limited duration health plans. This amendment exempts small group and short-term limited duration plans from providing a special enrollment period for pregnancy. However, pregnant women will still have the opportunity to purchase an individual plan which solves the problem of the special enrollment period if she works for an employer who does not participate. This is in addition to all other health insurance plans being available